Hi, I'm Dr. Jim Pollock. I'm an ER physician. I've been in practice for over 30 years. In the ER, we often have to start IVs, intravenous lines, in patients to give medicine, give fluids, give blood, take specimens, but they're very important. Occasionally, it can be you can have a problem with access to the veins because of scarring, swelling, or other deformities in the extremities. We almost always use a tourniquet on an extremity to dilate the blood vessel and make it easier to start an IV. That is not always sufficient if there's an access problem, as I just mentioned. The external jugular veins run laterally on both sides of the neck and are superficial and easily accessible and are kind of like the veins on your hand, on your arms, or in the back of your hand. You can't use a regular tourniquet on a person's neck because it would compress the airway and choke the patient. Other ways to help dilate the vessels on the neck would be to have the patient lie on their back with their head down, which is called a Trendelenburg position, or have them take a deep breath and hold it, which is called a Valsalva, and then the doctor or individual starting the IV can put pressure on the downstream portion of the vessel to help keep the vein dilated. These maneuvers aren't always available because of patient cooperation or patient illness, and sometimes it's just a difficult procedure. In that light, I invented this C-Tourniquet. It's a C-shaped clamp that fits on the neck and applies pressure just to the external jugular veins, allowing them to remain dilated and remain dilated for easier IV access. It allows free use of both hands, and we will demonstrate it later on in this program. The EJ clamp can also be used in clinics. It can be used by paramedics. It could be used possibly by the military, as well as in emergency rooms. This is the EJ clamp, and it fits on the neck as so. It just clamps on. Applies pressure to the external jugular veins and causes them to dilate and makes IV access easier. You can see there's no restriction on airflow and breathing. You're looking at the lateral aspect of this patient's neck, and along here runs the external jugular vein, which will dilate if your patient is in a position of head down or Trendelenburg or with a Valsalva maneuver, which is a deep breath. Normally it is not as visible without those maneuvers. Now, to start an IV without using the EJ clamp, which we've discussed already, one has to press the vein, blocking downstream flow to dilate it. And you can see here it doesn't really dilate significantly. This would be an attempt to put an IV in without using the clamp device. Find the vessel and hold downstream pressure. You can see the vessel right here. It's not as visible, but the IV could be started here. It's a little more awkward because you're using one hand is being used to clamp and not available for other work. This shows the EJ clamp being applied to a patient. This shows the results of the vein dilation after the EJ clamp is placed on the patient. This demonstrates aspiration of blood from the cannula inserted into the EJ.